Hello, my name is Eoin Stephens, and I'm the program leader for the MSc Addiction Counselling and Psychotherapy, uh, offered by PCI College and awarded by Middlesex University. So I'm here to tell you a bit about that course, just to give you a flavour of what it involves and why it's needed, why it might be useful to you. And if you have any further questions, then you can contact us and we can help you try and clarify anything you need to clarify. You can contact the college, you can contact myself directly if you need to, and the college can give you my email address. So, first of all, we're dealing with the field, obviously, of addiction counselling in providing this master's degree in what we're calling addiction counselling and psychotherapy. The probably more common term is addiction counselling, but there's no clear distinction between counselling and psychotherapy. We're helping people with problems in their lives, and particularly in their mental health, their behavioral health. And so addiction is simply one of the problem areas that human beings struggle with and that counselors and psychotherapists work with. So first of all, it's useful for me to talk just a little bit more about addiction, the problem. And, maybe one thing to say at this point is that this is an area I work a lot with myself. So this is why I'm involved in this particular program as program leader, but also as one of the lecturers in some of the modules, some of the topics. And indeed, as a counselor and psychotherapist who works with a range of areas, I work a lot in private practice these days with issues like anxiety and depression and a whole lot of other range of issues, often overlapping with addiction, but I also work with addictions. As somebody who works in all those areas, I did start out as an addiction counsellor, as primarily somebody working in the field of addiction, and I worked in addiction treatment. And so it is my longest area of experience and interest. And it's a big problem. Addiction is not new and it's not going away. So it's an issue that's out there in a variety of ways, and which means that help is needed and people need to be trained in this field. And again, just to give a flavour of the problem, which then links back to the course and what the course provides. First of all, addiction is something that is a term that can be applied across a variety of behaviours. Things like use of alcohol, the use of other substances, psychoactive substances like cocaine or cannabis or heroin, but which can also be applied to particular kinds of problems in people's use of gambling, their use of pornography, their use of gaming. That's a newer issue and a newer area for us to look at. So first of all, there's this distinction often made between substance addictions and behavioral addictions. Substance addictions is something that is, if you like, an older idea. Alcoholism in particular is probably the most familiar area of addiction to most of us, certainly most of us in Ireland, but in a way it was the first area to really be identified as an area where we could talk about something like addiction, alcoholism specifically. And, it's interesting to look at both the commonalities between all these areas of addiction. In other words, what is addiction? Addiction is addiction, no matter what you're addicted to. And also to look at, of course, all the differences across being addicted to gambling, being addicted to heroin, being addicted to alcohol, being addicted to possibly some more modern addictions, maybe social media. So that's a slightly newer and more controversial area of possible addiction. But certainly there's nothing new about, for instance, gambling addiction as a behavioral addiction. So, as I say, it's useful both to look at the differences. What do we need to know in order to work with someone who's addicted to gambling? What do we need to know in order to work with someone who's addicted to heroin and a variety of street drugs, including prescription drugs that weren't prescribed but are available on the street? And while, of course, there are differences, there's territories we need to know and understand and know something about and have some familiarity with. I mean, currently, for instance, I would be very familiar with the whole area of sexual addiction, and I would uh, therefore, be familiar with how it presents nowadays, the sort of areas, for instance, that people become addicted to, how it affects them, how it affects their partners, how that differs maybe from some other addictions. I'd probably be more familiar with that than many therapists. But on the other hand, currently wouldn't be very up to date on working with street drug addiction. I know the basics and the general territory, but I wouldn't be as up to date with it as some people would be. So there are those differences. But of course, and we talk about those things on the program. In other words, we cover a range of addictions, and we have a specific module on the behavioral addictions because they're the least known, as one of the modules that I usually teach. But of course, the other key thing that we all need to understand, as I said earlier, is addiction is addiction. So if we're addicted to anything, then there are common factors, common dynamics, if you like. Um, we're using something that's intensely mood altering and we're chasing the reward of it. We're developing a tolerance. We're losing control. It's becoming less rewarding, but we're becoming more preoccupied with it. We develop a certain level of mixed feelings and inner conflict and ambivalence around it. We love it and we hate it. We're causing lots of damage to our own lives and the lives of people around us, and we may then try and control it but fail. And all of that can be applied to any of these addictions. So there's some core things that everyone who works with addiction needs to know about, and obviously that, in a sense, constitutes the core of a program like ours, making sure that whatever you're already bringing in terms of knowledge, that gets very firmed up in terms of a real feel for the nature of addiction and the dynamics of addiction. And lying behind all of that, of course, is a whole set of theories about addiction and why it exists and just exactly what it is and which of the pieces there that I've talked about are more important to look at, and of course what helps. Probably the, in a sense, most controversial aspect of working in the field of addiction, and indeed the field of counselling and psychotherapy, is that there are many theories, many approaches, and no full agreement as to how to work with these kind of problems. Now, there's plenty of agreement as well, and on the program we we give an overview of that kind of history and of the main theories and of the different views and different approaches. But, we also pick on some of the current modern evidence-based, widely used approaches like cognitive behavioral therapy and motivational interviewing and the 12-step approach. And, we dig a bit further into those, basing all of that on making sure that we are keeping an eye on our generic core skills that every therapist needs to have. Just good listening skills. That's what that boils down to: good active listening skills. So the course is quite hopefully wide, deep, and broad. And no matter how wide, deep, and broad a program tries to be, there's lots that it won't cover. These fields are always vast, but the feedback we get from students is that they get a very thorough and interesting grounding in many aspects of addiction and addiction counselling and psychotherapy. There's lots of questions, obviously, that you might have in relation to the program. So I'm not going to try and answer all of them in a short talk. And obviously, you send in your questions by whatever means through this Facebook page, to the college. Go on to the website. There's opportunities there to send in your questions, and we'll answer all of them as much as we can, and get to see you and talk to you if you want to pursue this further. But I'll just give a rough idea of some of what the course involves, and what it can do for you if you're considering it. And first of all, and you'll see some of these details by just looking at the website or the prospectus if you download it. First of all, it's a 2-year program, 2 full years. It runs through the summer of the second year, because there's a thesis to be done But it's a two years master's degree, MSc, awarded by Middlesex University. And the classroom commitment, the time commitment, obviously how much of that is online or offline in the coming academic year remains to be seen in all colleges. But the commitment, the classroom commitment is one weekend a month, approximately, Saturday and Sunday, full days. And obviously, then there's a time commitment outside of that, in the sense that there's coursework to be done, there's reading to be done, there's essays to be written. There isn't an exam. There's just ongoing assessment through things like essays. There's some live skills assessment in some components of the course. There is also client work that needs to be done. So the a clinical placement needs to be arranged. Some people already have something like that in their working lives, depending on what background you're coming from. Otherwise, we'll set up a clinical placement for you, a relevant one. So there's 100 hours of that need to be done over the duration of the course, and 20 sessions with a supervisor to cover that work. Also, 20 hours of personal therapy. Now, many people, again, are already doing that, and some aren't, but 20 hours of personal therapy, just to help you process the material that's coming up on a course like ours. And yeah, we cover, as I said, then topics such as the history of the field, the nature of the different substances of abuse, the core generic skills that we all need, the specific useful skills for addiction problems in clients, such as motivational interviewing skills and cognitive behavioral skills. We cover, as I said, specifics around, more knowledge around behavioral addictions, including, as I say, some of the more recent ones like gaming addiction, what we know of that. And we also, look at things like dual diagnosis, the sort of problems that arise when somebody has an addiction but also has another mental health problem, like an anxiety problem, like generalized anxiety, or panic attacks, or a problem like depression, or any of those other problems, often which are linked, often in both directions, to the addiction. So, as I said, a lot is covered. And gives people a very, very good grounding in the field. So I suppose the possible advantages of doing a program like this are multiple. I mean, first of all, they're simply what you learn. So it's like when we do a workshop, we learn something, but we don't necessarily get a qualification out of it. But obviously, by doing an intense program like this, there's a massive amount of learning, and huge levels of confidence can come out of that, and a very impressive body of learning and professionalism. But of course, secondly, there is the award of master's degree, and particularly in our field, the level of qualification and required qualification and expected qualification is rising all the time, as I'm sure many of you know. And we don't quite know where that'll go in the next few years in terms of what will ultimately be required, by statutory regulation, both to generally qualify as a counsellor and psychotherapist, or to specialise in something like addiction. But a master's degree is an extremely safe bet, obviously. If you have a master's degree, then you're well ahead of the field, and as qualified as most people get. Obviously, beyond that, it's only doctorate, and that's pretty rare. So, from a point of view of future proofing, of being in a good position to do job interviews in the field of addiction counselling, then it's a very useful thing to do. The other thing to keep in mind is that some degree of specialization is definitely needed. Having a basic qualification in counseling psychotherapy is fits us, and qualifies us to do a lot. But many areas after our basic qualification need further study, and most of us wouldn't work with very serious trauma, for instance, on the basis of a bachelor's degree in counselling psychotherapy without doing further training. There are many things we would do, and many people we will work with, and even then we have to do lots of continuing professional development. But we wouldn't work with, highly suicidal clients on a regular basis, again, without further education, without a serious level of further education, or clients with eating disorders. And addiction counselling is one of the areas that falls into that same category. It's complex in itself. There's a lot to learn. While people are people and clients are clients, there are differences to addictions from other kinds of problems, and along with generic skills, basic skills, different skills are needed. And certainly in my own professional experience, part of my work in my private practice is referrals from other therapists for exactly that reason, because what's come up in doing other work with a client is fairly serious levels of an addiction or a variety of addictions, or at least a question around those, and particularly if it's around some of the behavioral addictions that I more specialize in, things like sex addiction, porn addiction, and gambling and gaming, then the client will be referred on, and this is where addiction specialization comes into the picture. The other question that ties in with that is the whole question of accreditation by accrediting bodies. Now, the whole issue of specialized accreditation as distinct from accrediting people as counselors and psychotherapists, the whole issue of specialist accreditation is still very much in flow. Even general accreditation obviously is only carried out by professional bodies. There's no statutory regulation of that. In the case of addiction counselling, the picture is the same. There is a professional body, Addiction Counsellors of Ireland. They provide accreditation for addiction counsellors. But again, the field is very much in flux. So at the moment, they have more been dealing with people over the years who initially qualified as just an addiction counsellor. Whereas the territory we're moving into now is more commonly that people qualify as a counsellor and then specialise in the area of addiction. So currently, Addiction Counsellors of Ireland are looking at that. And again, it's part of the flux of the field at the moment that will come together in some sort of picture, some clearer picture, over the next couple of years, no doubt. But one way or another, having a master's degree is, as I said earlier in my talk, as safe a bet. I suppose I shouldn't be maybe using gambling language, but it's as safe a bet as you can get. So those are the sort of slightly more complex areas that are probably useful for us to talk about, more directly with you. In particular, some of the questions that people tend to have are around their own particular experience, their own particular qualifications. You don't have to have a qualification in counselling and psychotherapy as such to do this program. There are other helping professional qualifications that you can have. Again, have a look at the website or talk to us. And so depending on the experience you're coming with, depending on what you want to do after doing getting a qualification like this, the answers become individual at that point as to, what this program will do for you. So I'll leave it at that. That hopefully gives you a bit of a flavour and a bit of a sense of the program. And other than that, get in touch with us, ask us all your questions. If you're taking it further, we'll end up having deeper discussions anyway around all of this. So take care of yourselves. All the best.